Good afternoon. My name is Gladys Amasam. I'm your nurse today. How are you doing? So, the doctor prescribed some medication for you, and the name of the medication is Carbamazepine. The Carbamazepine is the generic name for the drug, and it has other brand names. So, I will let you know the names of the drugs so that when you see them or when you go pick them up, you wouldn't be surprised or doubt it. Other names for the medication is Gabatrol, Mazepine, or Equitrol. So those are the brand names of the medication, and the generic, as I said, is Carbamazepine. The reason why you are taking this medication is to help treat your seizures, so that we can bring the seizures down, or if possible, can treat it and help you stay away from seizures. This medication works by stopping the electrical activities in your brain so that the nerves does not overwork. And if I may bring it down, what I'm trying to say is in our brain, there are cells in the brain that communicate to each other. And when they communicate to each other, one cell will send information to another cell, and the other cell will process that information and also send it to another cell. So that is how it works. So the information are given, processed, and giving it back to other cells. So when those information are overwhelming, are overloaded, the brain, the cells are not able to process it, so it becomes confused, and when then confusion sets in, so the brain is like, I don't know what is happening, I don't know what is going on. Then I can process this. What is this? What is he saying? What does he want me to do? So it's in a state of confusion, and that is what happens when seizure. That is what creates seizures, because the brain is confused. It's overworking. It cannot slow down. So confusion is all over the place. That is when you get seizures. So this medication is going to work by stopping the activities or the overworking of the brain, of the cells sending information. It's going to slow it down, or it's going to stop it, so the brain does not get overwhelmed or confused. So that is how this medication is going to work, help you out, so that it's going to treat the seizures that you're having. So some of the things that is going to do is going to reduce seizure activity. It will relieve some facial pain, and also like decrease the seizures, as I said before. So normally you are going to take 400 milligrams of this medication per day, and there are two ways that you can take the 400 milligram. That is how it's prescribed. So you can take 200 milligrams in the morning and 200 milligrams at night, or you can also take 100 milligrams times 4 a day. So depending on how the doctor prescribes it, and I think the doctor prescribed it 200 milligrams 2 times a day. So you're going to take 200 milligrams in the morning, then you're going to take 200 milligrams at night. But you have to make sure you do not exceed 600 milligrams per day. 1600 milligrams per day. So some of the guidelines for you to, or some of the things that I would like you to note, is that when you're taking this medication, there's a possibility of you having stomach upset. And when I mean by stomach upset, is like you can have uncomfortable feeling, like nausea, like vomiting. So to prevent these things, it will be a good idea if you take this medication with food. If you taking this medication with food, would decrease or help you with the stomach upset, so you don't get that discomfort from taking the medication. Another thing that I would like you to note is also not to take the medication or take grapefruit or grape juice while taking this medication. They do not work together. It will not help you, or it's not going to help the effectiveness of the medication. One more thing that I would like you to know is that this medication can cause sunburn. So it's a good idea when you're going out, you have clothes that can cover you your arms, your legs, like it can like give you a full coverage. And it's also advisable to use sunscreen when you're going out, or even when you are indoor, because when you are taking this medication, you are at high risk of getting a sunburn. So some of the side effects, it has side effects of this medication, and some of the side effects that I want you to look out for will be headache, blurred vision, retaining fluid, skin rash, and drowsiness. So the retaining fluids is very important for you to report to the provider, especially when it's a good advice to weigh yourself every day when you're taking this medication, so that you know if you're gaining weight or you are maintaining your weight. If you see that you are gaining rapid weight, then it means you are retaining water, and that is not a good thing. So you need to report this immediately to your provider. Another thing is also blurred vision, which you are not seeing clearly, or your vision is blurred. I would like you to also report to the doctor. Another thing is drowsy. It can cause drowsiness, so you do not drive when you take this medication, or use any machinery or anything that needs your full alertness. Another thing to report to your provider is fever, sore throat, easy bruising, decreased urine output, as I said, because if you have decreased urine output, it means you are retaining water, and that is not good. And also edema. If you see that your feet are swollen, you feel swollen, heavy, that is also another sign that you are retaining water. Then when you have shortness of breath, like the little things that you do, you feel tired, like you have a hard time breathing, that is also another thing to report to the provider immediately. What do you think? Okay, so these are some of the things, and I really want you to, the things that I just mentioned, things to report to that. I really want you to pay attention to those things and report them immediately to the provider, and this will help the provider so can adjust the medication or change the medication if they need to be. If you have any questions, don't hesitate to call us, and the number is 775-257-9232. I would like you to call or send us an email on nrh@lpnt.com, or you can always make an appointment and come back and see us. So don't hesitate to call us or to let us know if you have any questions, if you have any concerns. Please reach out, and I'll give you this information, this pamphlet. It has all the information that I just mentioned, and if you see anything that you do not understand, do not hesitate to let us know, and we will help you out with that. Thank you.